Hi, I'm Kelsey Jura, and I did depression from an integrative health perspective. What is depression? Depression is a mood disorder that interferes with everyday life and has feelings of sadness, loss, anger, or frustration. Here's a YouTube video on the signs and symptoms that you would see of depression. So if you want to watch that, please click there. Symptoms and risk factors of depression. Some symptoms and risk factors that we see with people that have depressive symptoms are the feeling of becoming isolated or withdrawn from regular daily life, lack of energy or fatigue, changes in sleeping patterns, so not having enough sleep or having too much of sleep, feelings of self-guilt, so feeling that you are worthless or you have your own personal hate toward yourself, loss of interest in activities, so activities that were once enjoyed like hobbies or something that you would do with your children. If severe depression, there may also be psychotic symptoms such as hallucinations and delusions. Stressful life events, failing a class, death of someone close to you, divorce, childhood abuse, or job loss, or social isolation, which occurs mainly in the elderly. Alcohol abuse, some medical conditions like cancer or long-term chronic pain, and certain medications such as steroids, which create a more anxious person and have more depressive symptoms if they do take steroids. There are 6 different types of depression. The most severe is major depressive disorder, which is a combination of symptoms that interfere with everyday life, like sleeping, eating, studying, and enjoying everyday activities. Major depression lasts long and could be potentially disabling to one's life. This clinical depression is not just occurring once in one's life, it can recur throughout an entire lifetime. The next type is chronic depression or dysthymia. It's long-term, 2 or more years in length. It's less severe than major depression and typically does not disable one's life. You may experience episodes of major depression. The next type is atypical depression, and when noticing atypical depression, you notice habits of repetitive sadness, altered sleep patterns, and change in appetite. The next form of depression is bipolar depression or manic depression. It's a mood disorder that changes between periods of clinical depression and extreme elation. There are 2 subtypes of bipolar depression. Bipolar 1 depression, which is a more severe form, where patients have at least one form of manic episode and have without major depressive episodes. Bipolar 2, which is the most severe of the 2 bipolar depression disorders, is where patients have a history of at least one maniac episode and have one mildly elated episode. The next form of depression is postpartum depression, or known as the baby blues. 1 out of 10 mothers get this major depressive episode. It's when 1 month after the delivery, the mothers have these depressive symptoms. And the last form of depression is psychotic depression. It's when delusional thoughts or other symptoms of psychosis accompany depression symptoms. Feelings of a break in reality, hallucinations, or delusions may occur. There are forms of prevention when it comes to depression. Do not drink alcohol or use illegal drugs. It can strengthen your thoughts of suicide and make depression worse. If on medication, take exactly how your doctor has instructed. There could be possible negative side effects to improperly taking your medications. Some other forms of prevention would be exercising. Exercising releases stress and feelings of sadness. Talk to someone. By talking to someone you trust about your feelings, that you can open up instead of letting feelings of sadness build up inside of yourself. Be around caring and positive people. And look for activities that bring happiness and pleasure. Some examples would be something creative, like drawing or singing or something music related, playing sports, and spending time with friends and loved ones. There are many types of treatments for depression. On this slide, the treatments for depression mainly occur within the United States. Some medications for antidepressants that are used are serotonin inhibitors, serotonin norepinephrine inhibitors, tricyclic antidepressants, and bupropion. St. John's wort is an herb that is naturally used to help relieve depression and anxiety, and it dates all the way back into the ancient Greeks. Another treatment is talk therapy, which is counseling to talk about your feelings and your thoughts. There are 3 types. Cognitive behavioral therapy teaches you to fight off negative thoughts and become more aware of signs and symptoms. And patients here are taught problem-solving skills, so when they are out of the therapy setting and into the real world, they are able to determine how they can stop themselves from feeling sad or anxious or depressed. Psychotherapy is understanding issues behind your thoughts and feelings, knowing where the problem started and trying to stop it right there. And the last form of talk therapy is support groups. So sharing your problems among others in similar situations and hearing thoughts who have the same problems. Another treatment for depression is electroconvulsive therapy. And this is the single most effective treatment for severe depression. It may help those who have psychotic symptoms, and it is when seizures are electrically induced in the brain of a patient. Transcranial treatment is a magnetic stimulation where pulses of energy stimulate nerve cells in the brain and affect mood in a positive way. Another treatment for depression is light therapy. Also known as phototherapy, it treats seasonal affective disorder where depression occurs mainly over the winter months. Having exposure to artificial light will help mimic outdoor light and affects brain chemicals that are linked to mood. Places like Seattle and Alaska that have colder, cloudier climates, the majority of the year is where light therapy mainly occurs, but it can occur anywhere in the United States or even around the world. For integrative health treatment for depression, there are many different practices that are used. An example would be mind and body practices, so meditation, the relaxation response, and forms of hypnosis. For hypnosis, imagery is used where the patient pictures scenarios of relaxation and healing. Another form of integrative health therapy would be music therapy, and that's where patients are actively listening or performing music to promote health and healing. Another integrative health treatment would be botanical medicines, and there are many types of natural medicines that can help lower depressive symptoms. So for example, B vitamins for production of regulation of neurotransmitters, which has a connection to depression. 1/3 of depressed adults have a folic acid deficiency, so taking a folic acid supplement will help lower your chances of depression. Omega-3 fatty acid deficiency is also correlated with increased anxiety and depression. And lastly, valerian, which is a European botanical used as a calming agent, and when combined with the St. John's wort on the previous slide, it has even more positive results. The last integrative health treatment for depression would be naturopathic medicine. And in naturopathy, it identifies unique aspects of each patient. It alters the treatment so it is specialized through specific natural therapies to restore physiological, psychological, and structural balance. Diet, exercise, natural botanicals, and supplements are also used in naturopathy. Some traditional Chinese medicines like acupuncture, massage, and movement practices like Tai Chi are used. And in homeopathy, they use diluted doses of medicine to stimulate the body's own natural defense. This creates balance physically, spiritually, emotionally, and mentally. And for integrative health, the major forms that I found that help with depression were yoga and acupuncture. And in the first case study I found, yoga and neuropsychiatric disorders, they used 4 randomized control trials in the study. And yoga played a major role in treating depression, cognitive impairment, schizophrenia, and sleep complaints. And it helped improve positive and negative symptoms. It improved the quality of life and socio-occupational functioning in patients with depression. Another case study was acupuncture and depression. And in this study, 1,400 citations for patients with headache, chronic pain, sleep disturbance, cognitive function, anxiety, and depression were used. And for all the different types of components for acupuncture use, all were promising and yielded positive effects. And as you can see of all the illnesses above, headache, chronic pain, sleep disturbance, cognitive function, anxiety are all different things that can lead to depression. So knowing that it yielded all positive effects in all areas created a very promising use of acupuncture in terms of depression and all the other illnesses above. So for questions for this project, I wanted to ask, what are some other ways that you personally use to keep yourself from being sad, anxious, or stressed? For me, I would normally use working out as one, and then I also try to keep my mind off of things by watching TV, which helps a lot, and even just deep breathing. So I have a lot of stress anxiety when taking tests, so right before I usually take deep breaths and count to 10, and that helps me a lot with my stress anxiety, especially during tests. And another question I asked is, would you be comfortable in recommending the different forms of integrative health for depression to someone that is having trouble overcoming depressing thoughts? And the last question I ask is, would you rather take prescription medication for depression or use a herbal natural remedy to help aid in sadness? And here are my references, and thank you very much.